Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over a comprehensive dosage calculations review. And what I'm going to be covering are all of these different types of calculations that you want to know as a nurse. Now whenever you're done watching this video, you can access the free quiz that will give you a comprehensive review over these calculations. So let's get started. First, we're going to work some basic conversion problems, and this really lays the foundation for us being able to solve dosage calculations. So what we'll do is we'll build upon this, and as we go on, these problems will become more complex. Now before you even start working dosage calculations, you have to commit to memory that metric table. And here's an example of the metric table. So you want to take this information and you want to put it in your brain, because you're going to be pulling from this table to help you solve these problems. Now let's work our first problem. So it says 9 ounces equals how many milliliters? So we're trying to figure out how many milliliters are in 9 ounces. And I'm going to be using dimensional analysis to work our problems. So we're going to go ahead and set that up. So we know that we have 9 ounces. And we need to figure out how many milliliters. This is our destination. This is where we're getting. So we're going to pull from the metric table. We know that in 1 ounce, there is 30 milliliters. Oh, so we're there. We've arrived to our destination. So we're going to cancel out our ounces, because that cancels out. And we're going to multiply everything at the top, everything at the bottom, and then divide, and we have our answer. So 9 times 30 is 270, and then 1 times 1 is 1. When you divide that out, you get 270. So 9 ounces equals 270 milliliters. Now we're going to work our next problem. It says 30 milligrams equals how many micrograms? So we're trying to figure that out. Again, we'll set up our problem using dimensional analysis. So we say 30 milligrams. And we've got to ask ourselves, using the metric table, how many milligrams equals micrograms. So we know 1 milligram equals 1,000 micrograms. And that is where we're supposed to get. That's our destination. So milligrams cancels out. We're going to multiply everything at the top, everything at the bottom, and then divide. So 30 times 1,000 is 30,000. And 1 times 1 is 1. Divide that out, you get 30,000. So 30 milligrams equals 30,000 micrograms. Our next problem says 10 teaspoons equals how many milliliters? So let's set our problem up again with dimensional analysis. So 10 teaspoons. And pulling from the metric table, we know that 1 teaspoon equals 5 milliliters. So that cancels out our teaspoons, and we've arrived where we need to get. So multiply everything at the top and bottom and divide. So 10 times 5 is 50, and then 1 times 1, of course, is 1. And so our answer is 50. 10 teaspoons equals 50 milliliters. Then over here, our next problem says 0.5 grams equals how many micrograms? So let's go ahead and set our problem up using dimensional analysis. So 0.5 grams. And we have to think back to our metric table. We know that there is 1 gram in 1,000 milligrams. And grams cancels out, but we're not done because we have to get to micrograms. So we need to do one more step. So we know that in 1 milligram, there is 1,000 micrograms. So we have arrived. That's where we need to get, was micrograms. So milligrams cancels out over here. And so what we're going to do is we're going to multiply everything at the top and everything at the bottom. So 0.5 times 1,000 is 500,000. And then all of this multiplied together is 1. So our answer is 500,000 micrograms. Now, some of you had some questions in my previous video where we did basic conversions, and you're like, well, can I do it this way? Like maybe go with, like, for instance, this problem. we went from ounces and we went straight to milliliters. But if you pulled from the metric table, this is what's really cool about dimensional analysis. You could have went from ounces and then went to tablespoons, and then eventually you could have got to milliliters. So it would have sort of looked something like this, like a little 3-step like that. And our last conversion problem says 170 pounds equals how many kilograms? So we're going to set up with dimensional analysis. So 170 pounds. And we know that from the metric table, there's 2.2 pounds in 1 kilogram. And that's where we need to get was the kilograms. So pounds cancels out. We're going to multiply and divide. So 170 times 1 is 170, and 1 times 2.2 is 2.2. Now we're going to divide. 170 divided by 2.2 is 77.2727 repeating. And I'm going to round to the nearest tenth. And you always want to make sure that you follow your program's rounding rules for how they want you to round these problems. Now we're going to work an oral liquid medication problem. And this problem says that the doctor writes an order for a medication that is in an oral suspension. The order reads to administer 50 milligrams by mouth every 4 hours as needed for pain. You're dispensed with a bottle that reads 25 milligrams per 2 mLs. How many teaspoons will you administer per dose? So this is the important information we need to pull from this problem in order to solve. So again, we're solving for teaspoons per dose. So let's set up using dimensional analysis. So the doctor orders 50 milligrams every 4 hours. So 50 milligrams is how much the patient needs to receive in this oral suspension. We have a bottle of this medication that says for every 2 milliliters that you're pouring out, there's 25 milligrams of this medication. So we're going to put 25 milligrams down here, and we have 25 milligrams equals 2 mLs of medicine. This cancels out our milligrams. Now we have to get to teaspoons, so we're not done. So we're looking at the metric table for this. So we know that in 5 milliliters, there's 1 teaspoon. This cancels out milliliters, and we are where we need to be. So multiply and divide. So 50 times 2 is 100, and 25 times 5 is 125. We divide that out, and we get 0.8. It'll be teaspoons per dose is our answer. Now let's work a capsule and tablet problem. So our problem says the doctor writes an order for a medication. The order reads administer 0.5 milligrams by mouth daily. You're dispensed with a bottle that says 100 micrograms per tablet. How many tablets will you administer per dose? So we've pulled the important stuff out that we need to know about this problem in order to solve. So we need to figure out how many tablets we're going to give this patient based on what the doctor ordered. The doctor ordered 0.5 milligrams, and we have a bottle of tablets that says every tablet is 100 micrograms. So let's set up our problem using dimensional analysis. So doctor ordered 0.5 milligrams. And we're supplied with some tablets that are in micrograms. So we have to get to micrograms right now. So from our metric table, we know that in 1 milligram, there are 1,000 micrograms. That cancels out the milligrams. And now we can plug in our amount that we're supplied with. So we know that there are 100 micrograms in 1 tablet. Micrograms cancels out, and that's where we need to get was tablets. So we're ready to solve. Multiply and divide. So 0.5 times 1,000 is 500. All this down here, 1 times 100 is 100. And then we divide that out, and our answer is 5. So we're going to give the patient 5 tablets. Now we're going to solve an IV bolus problem, and this problem says the doctor writes an order for an IV medication that reads, administer 1 milligram IV now. You're dispensed with a vial that contains 0.4 milligrams per ml. How many mLs will you draw up to administer? So here's the important information we need to know to solve the problem, and we're trying to figure out how many milliliters we're going to withdraw from this vial to equal out a 1 milligram dose, because our vial says for every milliliter that is in this vial, it equals 0.4 milligrams. So let's set up our problem. So the doctor ordered 1 milligram, and we need to get to milliliters. So we know that from our vial that it contains 0.4 milligrams in every milliliter. That cancels out milligrams, and we are ready to solve. So 1 times 1 is 1, 1 times 0.4 is 0.4, and we're going to divide out, and we get 2.5, and that's how many milliliters we would withdraw. Now we're going to solve some different types of IV flow rate problems. So the first one we're going to look at, we're going to try to solve for drops per minute. So this problem says the doctor writes an order to infuse a solution. The order reads, infuse 2 liters of D5 half normal saline with 50 milliequivalents of potassium chloride over 48 hours. The drip factor is 15 drops per ml. How many drops per minute will be administered? So we've pulled the most important information from our problem, and if you notice in our problem, it gave us some distractors. It told us that there was 50 milliequivalents of potassium chloride in this bag of fluids, and don't let that confuse you where you're thinking, oh no, where do I plug this 50 in at? Because it's just a distractor to throw you off. All you need to know is that you're giving 2 liters of fluid. It does have 50 milliequivalents of potassium chloride in it, but you're going to give that 2 liters over 48 hours. Now this problem also tells us a drip factor. Drip factors come from your IV tubing, and here in this bag it told us that our drip factor is 10 drops per milliliter for this specific IV tubing. But for our problem, it's telling us that for every milliliter that's going to be dropped, it's also called a drop factor, there's going to be 15 drops. So we're trying to solve for drops per minute. That's where we're trying to get. So what I'm going to do is I'm going to go ahead and convert our hours into minutes, because that's where we're heading. So let's go ahead and do that with our dimensional analysis. So we know that in 1 hour there are 60 minutes. And our problem tells us that we're going to give this solution over 48 hours. So we're going to go ahead and put 48 here, and we're going to give 2 liters. This cancels out our hours, and we have minutes. So we're almost there to drops per minute. So we need to plug our drip factor in, but notice our drip factor is in milliliters, so we have to get there because right now we're in liters. So we're going to pull from our metric table, and we know that in 1 liter there are 1,000 milliliters. So that cancels liters out. So we're in milliliters, but we got to get here. So now we're going to plug in rest of our information about our drip factor. So we know that 1 milliliter is going to equal us 15 drops. So that cancels that out. And we're where we need to be. We have drops per minute. We're ready to multiply and divide. So multiply everything at the top, we get 30,000. Multiply everything at the bottom, we get 2,880. And when we divide that out, we get 10.4166 repeating. And I'm going to round to the nearest whole number. So our answer is 10 drops per minute. Our next IV flow rate problem is going to deal with solving for the hourly rate, such as milliliters per hour. So this problem says the doctor writes an order to infuse a solution. The order reads, infuse 2 liters of D5 half normal saline over 48 hours. What is the hourly rate, milliliters per hour? So here's our important information we need to know. We're trying to get to milliliters per hour. That is our destination. So we know that the doctor has ordered 2 liters to infuse in over 48 hours. So we need to get to milliliters per hour. So we're already here in hours, but we need to get this to milliliters. So we know from our metric table that there is 1 liter in 1,000 milliliters. That cancels out our liters, and look, we're here, milliliters per hour, so we are ready to solve. So multiply everything and divide. So 2 times 1,000 is 2,000, 48 times 1 is 48, and when you divide 2,000 by 48, you get 41.66 repeating, and I'm going to round to the nearest whole number, and again follow your program's rules for rounding, and our answer is 42 milliliters per hour. Now let's solve an IV flow rate problem that wants us to solve for the infusion time. So when will this infusion actually be completed? So our problem says the doctor writes an order to infuse a solution. The order reads, infuse 2 liters of normal saline at 150 milliliters per hour. You start the infusion at 8 o'clock, and this is 8 in the morning. This is written in military time. At what time will the infusion be complete? So the important information we got from this problem is that the physician wants us to infuse 2 liters at an hourly rate of 150 milliliters per hour. So every hour that patient is going to be receiving 150 milliliters of fluid, but they only need 2 liters of fluid to go in. And we started the infusion at 8 a.m. So when will this order be complete? That's what we're looking for. So let's set up dimensional analysis. Patients ordered 2 liters, and the physician wants to go in at an hourly rate of 150 milliliters per hour. So notice we're here in milliliters, and we're over here we're in liters. So we got to use our metric table to get over there to milliliters. So we know from the metric table that in 1 liter there's 1,000 milliliters. So that cancels liters out. And we're going to go ahead and plug in our hourly rate because we're ready to. And the physician wants it to go in at 150 milliliters in 1 hour. So that cancels our milliliters out, and we're in hours. So we're ready to solve because we need a time. So this is going to tell us the hours. So 2 times 1,000 times 1 is 2,000. And everything multiplied at the bottom is 150. So 2,000 divided by 150 gives us 13.33 repeating hours. Okay, so we have that. But the problem is we have leftover hours. So we need to know minutes because we need to get a complete time for when this infusion was done. So we know it's going to take 13 hours, but let's convert our leftover hours into minutes so we get a complete time. So we'll go ahead and write 13 right here. So 0.33 hours, because that's what we're left with over here. And we know that in 1 hour, there's 60 minutes. So here we're at minutes, and that's where we need it to be. So 0.33 times 60 gives us 19.8, and then 1 times 1 is 1, and then we're going to round, we're going to divide, of course, that gives you 19.8, and then we're going to round to the nearest whole number, so that gives us 20. So it's going to take 13 hours and 20 minutes to infuse, but it wants to know the time. So 13 hours and 20 minutes from 8 a.m. in the morning would give us 9:20 p.m. But we need to write that in military time because that's how we give time in the medical field. So military time for that would be 21:20, and that is equal to 9:20 p.m. and that is our answer. Now we're going to solve a weight-based calculation. So this problem says the doctor orders an IV weight-based medication to infuse at 2 micrograms per kilogram per minute. The patient weighs 130 pounds. You are supplied with a bag of the IV medication that reads 250 milligrams per 250 mLs. How many milliliters per hour will you administer? So we've pulled the most important information from our problem to solve, and we're trying to figure out how much milliliters per hour we're going to give this patient from this IV bag of medication. And this medication is based on the patient's weight. So the doctor wants us to give 2 micrograms per minute for every kilogram the patient weighs. We're told the patient weighs 130 pounds. So right there, you know you're going to have to get from pounds to kilograms. And we have a bag that is in milligrams. The order is in micrograms, so we know we're going to be doing some converting there. And our bag is a 250 milliliter bag, and in that bag we have 250 milligrams. So let's set up and solve. So first thing we're going to do right off the bat is we're going to deal with this pounds, and we're going to get it to kilograms so we can start plugging in our doctor's order. So our patient weighs 130 pounds. And we know from the metric table that there's 2.2 pounds in 1 kilogram. So there we go, we have dealt with that. Now let's plug in what the physician has ordered. So for every kilogram the patient weighs, we're going to give 2 micrograms per minute. So that cancels out our kilograms. Now we can plug in what we are supplied with because we can start converting there. So we're actually in micrograms right now. We have to get to milligrams. So we're going to plug in that metric table once again. And we know that in 1,000 micrograms, there's 1 milligram. Cancels out micrograms, so we're done with micrograms. We can plug in what we have. So we have 250 milligrams in a 250 ml bag. That cancels out milligrams, and we have to get milliliters to hours. Right now we're in milliliters per minute, but we're going to go ahead and solve everything, and then we'll convert our hours to minutes. So we're going to multiply 130 times 1 times 2 times 1 times 250, and that gives us 65,000. Then we're going to do 1 times 2.2 times 1 times 1,000 times 250, and that gives us 550,000. Then we're going to divide that out, and that's going to give us 0.11818 repeating. So currently we're in milliliters per minute. That's not what our problem wanted. It wanted milliliters per hour because that's our rate we're going to set our pump. So we're going to convert that. We know that there are 60 minutes in 1 hour. So this is currently in minutes. So 1 minute is equal to this many milliliters. So 1 minute is equal to 0.11818, and that was repeating. And our minutes cancels out, so we are now ready to solve. So 60 times 0.11818 gives us 7.0908, and then of course 1 times 1 is 1, and then when we divide that out, that gives us, we're going to round to the nearest whole number, that gives us 7. So our answer is 7 milliliters per hour. Now we're going to solve another weight-based calculation, but we're going to apply that to the medication heparin because I want you to be able to see how to work a problem like that. So our problem says the doctor orders your patient to start an IV heparin drip at 5 units per kilogram per hour and to administer a loading bolus dose of 10 units per kilogram IV before initiation of the drip. You're supplied with a heparin bag that reads 12,500 units per 250 mLs. The patient weighs 110 pounds. What is the flow rate you will set the IV pump rate? So here's the important information we need to know. We're going to give 5 units per hour for every kilogram the patient weighs. They weigh 110 pounds, and we have a bag that is a 250 ml bag, and it contains 12,500 units. Now notice that this problem told you a loading dose to give before you start the drip. This can be ordered with a heparin drip if the physician orders it, but don't let that throw you off because that's just a distractor once again. So let's figure out the milliliters per hour, how we're going to set our pump to infuse. So first thing what we're going to do is we're going to deal with this pounds. We need to get to kilograms because that's how this drug is ordered. It's weight based. So our patient weighs 110 pounds. We know from our metric table that there's 2.2 pounds in 1 kilogram. So we're done with pounds, we're now in kilograms. And the order is for every kilogram the patient weighs, we're going to give them 5 units per hour. So for every kilogram the patient weighs, we're giving them 5 units per hour. Kilograms cancels out. And now we are ready to put in what we're supplied with. So we're told that in this bag there's 12,500 units in this 250 ml bag. So units cancels out and we're left with milliliters per hour. So we're ready to solve. So when you multiply everything at the top, you get 137,500, and multiply everything at the bottom, you get 27,500, and then we're going to divide that out. And whenever you divide that out, you get 5. So our answer is 5 milliliters per hour. Now let's solve a pediatric safe dosage problem where we're going to figure out the safe range for this pediatric patient based on the recommendation and their weight. So the problem says the doctor orders an IV drip for a child that weighs 78 pounds. The safe dosage range for the ordered medication is 5 to 10 micrograms per kilogram per minute. What is the safe dose range for this child? So here is the important information we need to know: the patient's weight and that recommended safe dose range for the patient. So we're going to be working like a two-step problem because we have to get 2 different numbers and we're trying to get to micrograms per minute. So we know that our patient weighs 78 pounds, so let's go ahead and deal with the weight and get it to kilograms because that's what our medication range is in. So the patient weighs 78 pounds. We know from the metric table that they are 2.2 pounds in 1 kilogram. That cancels out our pounds. And our dosage says that this child can have, for every kilogram they weigh, 5 micrograms per minute. So we're just dealing with this 5 because that's the lowest part of the range, and the 10 is the highest part. So we'll deal with the lowest part first, and we're ready to solve because we are in micrograms per minute. Our kilograms canceled out. So when you multiply everything at the top, you get 390. Everything at the bottom, 2.2. When you divide that out, you get 177.27, repeating, and I'm going to round to the nearest tenth, so 177.3. That's the lowest part of this range, but now we have to get the high part. So now we're just going to plug in the 10 where we did our 5 and set up the problem. So our patient weighs 78 pounds. We know that from the metric table there's 2.2 pounds in 1 kilogram, cancels out pounds. Know from our order that 1 kilogram, patient on that high end can receive 10 micrograms per minute. We're where we need to be, so our kilograms cancels out. We're going to multiply and divide. So when we multiply everything at the top, we get 780. Everything at the bottom, 2.2. When we divide that out, we get 354.5454, repeating. I'm going to round to the nearest tenth, so that gives us 354.5. And this is the safe range for this child based on the recommended dose and their weight. Now we're going to work a drug reconstitution problem. And this problem says the doctor orders 10 milligrams of a by-mouth medication that needs to be reconstituted. Instructions on the 0.25 gram container say to reconstitute with water to make a concentration of 0.5 grams per 3 mLs. You would administer blank milliliters per dose. So here's the important information we pulled from our problem. So we need to give 10 milligrams per dose, and we have a 0.25 gram container, and once it's reconstituted, we're going to have a dose of every 3 mils equals 0.5 grams. So we're trying to get 2 milliliters per dose. What are we going to give this patient? So what we're going to do is we're going to start with the amount ordered. So the doctor ordered 10 milligrams per dose. So we have to get 2 grams, and we're in milligrams because that's how much is in this container once it was reconstituted. So we know from their metric table that in 1,000 milligrams, there's 1 gram. So milligrams cancels out, and we are told that we have this amount. So 0.5 grams is equal to 3 milliliters, and this is what its value is once it's been reconstituted. So grams cancels out, and we're left with milliliters per dose, and that's what we need to know how much we need to give. So now whenever you multiply everything at the top and the bottom, you're going to get 30, and then on the bottom that would be 500. And 30 divided by 500 is 0.06. So we are going to give 0.06 mLs per dose. Now let's work a tube feeding problem. So our problem says the patient is ordered Gevity 1.2 cal. You're supplied with a can of Gevity that contains 337 milliliters of feeding formula. The doctor orders the tube feeding to be administered at 3/4 strength with a rate of 50 mLs per hour. How many milliliters of water will you add to dilute the tube feeding formula as prescribed? To solve this tube feeding problem, you have to memorize the following equation, and it's going to help us solve for how many milliliters of water that we're going to add to this feeding formula to dilute it based on what the doctor ordered. The doctor ordered a 3/4 strength, and the doctor also ordered for it to go in at a rate of 50 mLs per hour, but we really don't need that information to help us solve this problem. So we know that we have a can, and in the can it has a volume of 237 mLs, but we have to dilute that to a 3/4 strength. So this formula is going to help us do it. So what we're going to do is we're going to plug in our information. So the milliliters in the can, 237. So 237 mLs. We are solving for X. X is the total volume that is going to be administered. So we don't know what that is yet, so we're just going to put that there. And then the strength ordered is 3/4, so we're going to put 3/4. Now we're going to solve. You're going to multiply everything across from each other. So 237 times 4 is 948, and then 3 times X is 3X. We're solving for X. So what we're going to do is we're going to divide everything over here and everything over there. It's going to cancel this 3 out, so 3 divided by 3 cancels it out. And then 948 divided by 3 gives us 316. Okay, so 316 mLs is our total volume. That's what X told us. But we need to know how much water we're giving, because this is how much we're totally giving. So how much of that is water? So to figure that out, you just take 316, which is the total volume, subtract that from the original can size, which was 327, and you get 79 mLs. So we will give 79 mLs of water. Now we're going to wrap up this comprehensive review, and we're going to solve a body surface area calculation. So this problem says a pediatric patient is ordered a medication dose of 10 milligrams per square meter per day by mouth for 7 days. The patient weighs 46 pounds and is 3 feet 9 inches. What is the daily dose of medication the patient will receive? So we've pulled the most important information from our problem to help us solve, and we are trying to get to milligrams per day. Now the special thing about this medication is that it is ordered by the patient's body surface area. So it's telling us that for every square meter, the patient needs 10 milligrams per day, and this is going to be based on their height and their weight. That's how we're going to figure out the body surface area. And to do that, there's a couple of equations you can use, and we're going to use this one. And it tells us for what we're solving for is the square meter. So we're going to take pounds, multiply that by inches, divide that by 3,131, and then we're going to find the square root of that, and that's going to be our patient's square meter, their body surface area. Now to do this, you're going to need a calculator that can solve the square root. So keep that in mind. So we're going to go ahead and figure that out. And then we're going to solve for the milligrams per day using some dimensional analysis, and we'll get our answer. So let's go ahead and convert this. So we have 3 feet 9 inches. We need it all in inches. So let's go ahead and just figure that out. So we know that there are 12 inches in a foot. So 12 times 3 gives us 36. But they're 3 foot 9. So we're going to go ahead and add 9 because that's how many leftover inches we have. So 36 plus 9 is 45. So our patient is 45 inches. So we have 45 inches, 46 pounds. We're good to go ahead and plug into this formula. So let's just erase this and put it in. So 46 times 45. So what is that? That gives us 2,070. Go ahead and carry our square root down. And then we're going to divide that by 3,131. And when we do that, we are going to get 0.661306, etc. And what we're going to do is figure the square root out of that. So you'd plug that into your calculator. And once you do that, you are going to get 0.81. That's where we're going to round. And that gives us our square meter. So we have that information. Now let's solve using dimensional analysis. So that's important for us to know. So the doctor has ordered 10 milligrams for every square meter the patient weighs per day. So the patient's body surface area is 0.81 square meter. And for every square meter the patient is, they need 10 milligrams per day. Square meter cancels out, multiply everything at the top and bottom and divide. And once we do that, we get 8.1 milligrams per day. And that is our answer. Okay, so that wraps up this comprehensive review over dosage calculations. Now, if you would like a more in-depth look at each of these different categories, I have in the description below individual videos that will explain more in depth on how to work these problems. And don't forget to access the free quiz that will test you on this material.